Hello, good people. How are you today? I hope today finds you in perfect peace and that you are doing well in every area of your life. So, good people, today is June 15th. So, that makes it, I keep hearing that song in my head. Do you know what today is? So, today is June 15th, and that makes it the 15th day of Uterine Cancer Awareness Month. And I feel as a uterine health advocate that it is my responsibility and duty to align with such an initiative. And I've committed to posting something every day regarding uterine health, uterine cancer during the entire month of June, since June is Uterine Cancer Awareness Month. I also want to say thanks so much for engaging with the channel, whether you're subscribing, liking, commenting, asking questions, sharing the video. I so appreciate you. So thank you so much for engaging with the channel. And if you haven't engaged, this is your opportunity to engage. Yep. Come on. Go ahead and engage. So I want to always, I don't know what that was. I usually say each video, my disclaimer, I am not a medical doctor, and you can read the description in the bio. But I make sure I say it verbally because and then at the beginning, because I want people to know I'm not a medical doctor. I am a uterine health advocate, and I'm on a mission and a journey to learn as much as I can about uterine health so I can spread the message and that we can take away the stigma of suffering alone, the stigma of not wanting to talk about things that we're going through. So that is my purpose. And of course, I started with sharing my own journey, and you can go watch those videos. So let's get into it today. Okay. So yesterday, I had the beautiful opportunity. Okay, the mic's on. I had the beautiful opportunity of attending a women's health forum in honor of Uterine Cancer Awareness Month. The organizers of it did have a guest speaker, and the guest speaker was a medical doctor. The doctor shared about her uterine health journey, and I appreciated her vulnerability, her transparency, and sharing information, not just as a doctor, but as a woman, and the things that she had to decide concerning her uterine health that was going to be the most healthiest journey for her. And I appreciate that. But of course, she was a doctor, so she came in with the medical stuff too, which was great. So it was nice to see a nice balance of a doctor being that vulnerable, sharing their own personal journey. So during the Q&A, or the open conversation, one of the women, or a couple of the women, mentioned that they had ablation procedure. They had an ablation procedure, and a couple of women had, opened up about that. And I did want to interrupt and say exactly what type of ablation and what it was, because the moment was so beautiful, because women were sharing, they were opening up, and it wasn't like people were talking over each other, but the conversation was just flowing. And I just thought that question would have broke up the flow. And for me, anytime that I see women openly sharing, being vulnerable, and we're all learning from other people's journey, I didn't want to ruin that, because I thought it was just a beautiful, beautiful moment. But when they did say the word ablation, I remember reading about ablation in one of my books, and it also that I have at home, and it also made me think about something that I mentioned to my doctor from doing my own research on my own uterine health journey, right? So today I'm going to share with you some research regarding ablation. And so the correct name, if you ever want to look it up, is actually called uterine or endometrial ablation. But I'm thinking they're probably going to go more with endometrial ablation, but it might be either or if you're doing the research. So, and then I just want to quickly show you the book that I'm talking about, because I did a video about the importance of doing research. And I think I mentioned the book. So this is one of the books I have. This book is, I don't think, no longer in print. The latest version was 2006, and it's now 2026. But I remember that, as you can see, I really get into this book. But I remember they had a section on what is endometrial ablation. And I remember speaking to my doctor about this, and she just, said that that's not something that they do anymore, and it wasn't a good option for me. But I did, but still, I read this in 2025. So although the book is older, I was very glad to have it in the house that, I could, read about and have some reference point as I was on my own uterine health journey. And then, I have this book, which I also think is out of print because this is also from 2006 and it's 2026. But she did have information in here about endometrial ablation and shared, stories. And the last book. So, in the last book is the book I just got, and this is a book that was just published in 2026 by Dr. Kimmy Dahl, and she talks about ablation here. So the information I'm going to share with you, like the basic definition, they all three all kind of matched up. So the good thing for me is, although these older books are like from 2006 and it's 2026, the base information is the same, even if they are doing more of an aggressive, not aggressive, but more of advanced treatment now than maybe they did back then. So I just wanted to let you know that this was also in this book. And I haven't read this book. I think I'm going to start in July, but I'm going to highly recommend it. Why not? Have some resources in your house so that you can quickly look up and, do like I do, tag the whole book so you'll know where things are. So let's get into it. So sorry for the sidebar. No, not sorry for the sidebar. I'm sharing everything uterine health, and part of doing uterine health is having a well diverse, research opportunity. There you go. So uterine endometrial ablation is a procedure that permanently destroys or removes the uterine lining, which they call the endometrium, to treat women that have heavy menstrual bleeding. It is a procedure that's minimally invasive, and it can be an outpatient treatment for women for women who have completed childbearing. So this is something that women that have heavy menstrual bleeding, and it's minimally invasive. So heavy bleeding, minimally invasive, and it's for women that have completed childbearing. Childbearing meaning that you've already had your children and you're not looking to enlarge your family. Add to your family? Yeah, maybe that's a better word. So, and also women that have that experience that those debilitating cycles that just have you in so much discomfort and pain, that they do this because most times when doctors refer this, I'm moving this up a little bit. Most times when doctors refer this to you, they do offer a hysterectomy. So this is another option before you have a hysterectomy, if that's on the succession plan with you and your doctor. So they say that there are several benefits to having this uterine ablation, excuse me. So it is for women that have heavy and prolonged bleeding. It's defined as women that have such heavy bleeding where you have the soaking of the pad and the tampon every hour, periods lasting longer than 8 days, and bleeding interferes with your daily life. When I think about this, I think about the one lady at the forum yesterday that openly shared. I mean, she was so brave to me, that how, this was her. She said that she had to sleep with a pad on her bed, and she couldn't really sleep because she was constantly going to the bathroom, changing her pads, and going to work was difficult. You got to make sure you wear black or something like that, and just sharing her vulnerability of how much pain that she was in. That one day she said she woke up and was in such bad cramping that she was bent over. And when she finally got to the hospital, they were able to provide her something that causes her to sit back up straight. So, when I was thinking about this earlier, later as I was on the ride home, I was just like, we are fearfully and wonderfully made. And, we go through a lot as women, So I can understand how a shame and embarrassment would come from that, because if you're out and about, you can't probably wear white or yellow or anything like that, and nothing over the counter is working for your cramping, and you can't even go out and enjoy life because you have this heavy, just bleeding. Yeah. Okay. We just go through a lot as women, and the more that I do research for this channel, and I'm learning myself. So the first reason is heavy, prolonged bleeding. The second reason you might be anemia. So you might have this surgery for correcting your low red blood cell count, and that causes you fatigue and chronic and excessive blood loss. So that's the second reason why you have that. The third reason would be you have abnormal uterine bleeding. So this procedure would treat irregular menstrual cycles or bleeding between cycles. And again, like I said, the fourth one would be that this is an alternative to a hysterectomy because it's a less invasive procedure for people that want to have, for women that want to have their uterus remain intact. And then the last reason people might have this is due to failed medical therapy. So, your doctor may have, prescribed you on all kinds of things that, try to slow the flow of the bleeding down. It didn't work, even like, stuff like an IUD and other contraceptives. So they failed to control the bleeding. So this is might be an option that your doctor recommends for you. So some of the benefits and effectiveness of having the uterine endometrial ablation is that it does reduce the bleeding. And it says approximately 90% of patients experience significantly lighter periods or it may stop bleeding entirely. And of course, the other benefit, like I said before, it's less invasive because it leaves your uterus and your ovaries intact. And, it serves as another way that you don't have to have a hysterectomy. One of the things that I'm very glad about too, when I share information on here, because we all know that from the past, and I've mentioned this before on this channel, that, they always say the very first thing, oh, just have a hysterectomy. That's always been like the prescribed thing. And they said definitely with African American women, they've always, prescribed that to us the most. And so I think about you think about your mother, your grandmother, your great grandmother, and women. So, the ancestors, and you think to yourself, wow, they just that was the only option for them. And now you have the ability to go on YouTube or any other kind of social media site and see people, or do your own online research, or, like I always say, get a book and you can find out there's different methods. And so again, one of the reasons why I like to present information, because I'm learning too, is that when your doctor says, oh, we'll just do a hysterectomy. Well, no, what about this ablation thing, procedure? It's that way where you can have a more informed conversation with your doctors and you don't let them tell you how to handle your body without talking to you and developing a health plan of healing for your body. Now, there may be some instances where hysterectomy is it. That's the final thing that can, help you, through whatever you're going through on your uterine health journey. I understand that, but that shouldn't just be the first thing without us talking and having a conversation and going through some other procedures. So that's when I say you still have to take charge of your own health so that y'all can develop something that you feel comfortable with, that is going to bring healing to your body. Okay. And so the next thing I, discovered was, and that's why I say when I go do online research, I type in a bunch of different things to get the answers that I need. So who should not have this procedure, right? So pregnant women, that makes sense. You can't have this type of procedure if you're pregnant. It might just, harm the pregnancy. So, and the second is 4 reasons. So pregnancy is one. And the second one is those that wish to conceive, because pregnancy following this procedure, the ablation procedure, is rare, but it can occur. And if it does occur, it is highly dangerous and frequently ends in miscarriages. And then you got to go back to using reliable contraceptives to, control the bleeding. So if you would like to have a child, this is not the procedure for you. So that's the second one. So the third one is women who have gone through menopause. So, that put a pause for me. I'm like, what? So women that have gone through menopause cannot have this. The fourth and last reason why women that should not have this procedure is women that with uterine cancer, precancerous growth, and severe pelvic and uterine infections. So if you're pregnant, you want to get pregnant, you've gone through menopause, and you've been diagnosed with uterine cancer, precancer growth, and severe pelvic and uterine infection, this uterine endometrial ablation is not right for you. So if you're any one of those categories and your doctor brings that up to you, that should be a red flag about that doctor, right? This is why you got to know all of your information. So when you go in, and you do your research, I did what is, because I didn't remember the full name, so I just typed in what is ablation for and women's health. And then I did like, well, who should have this procedure? Then I did like, who shouldn't have this procedure? But you already know, when I saw the third point of who shouldn't have this reason, I went in and typed in, why shouldn't postmenopausal women have endometrial? I think I might put in uterine ablation. So here's what I got. So that's why I say the more you put in and you dig a little deeper, the greater information you will find. Which, once I knew the name of this, drew me back to my books. So I just quickly read a quick paragraph about it because, just wanted to refresh my memory of what I did read. But I'm learning so much more today. So uterine ablation is generally not recommended for postmenopausal women, excuse me, because the procedure destroys the uterine lining. That's the whole purpose of this, because it stops the bleeding. And so if you're premenopausal, it can dangerously mask underlying conditions like endometrial cancer, fail to address the root cause of postmenopausal bleeding, and can make it nearly impossible for doctors to detect and diagnose early stages of malignancies. Malignancies are the presence of cancer cells that grow in an uncontrolled manner. So these are things that, from I just read, if you're postmenopausal, why you shouldn't. But I do have 4 main points as well why you shouldn't have this procedure if you're postmenopausal. So number 1, it can mask cancer cells. The main purpose of an ablation is to stop abnormal uterine bleeding by destroying the endometrium, which is the uterine lining. After menopause, any unusual bleeding is a red flag and could indicate uterine cancer or precancerous growth. Ablating the lining destroys the very tissues that the doctors need to do a biopsy to make a cancer diagnosis. And when I think about that for myself, because that was the red flag that started my uterine journey, right? I saw the bleeding postmenopausal, and that was a red flag for me, and that was been a red flag for my healthcare providers. So we have all been on the same page. I was just like, okay, good. So I kind of lowered that a little bit too. And so, see, we're like friends having a conversation. So this is what we do when we have conversations, right? We divert into do something else. So that is the first thing. It can mask, cancer cells. And we definitely know when we want to go to the doctor, we want to be able to be tested appropriately for cancer cells. So number 2, for postmenopausal women, why we should not be having this ablation procedure is it can delay diagnosis. So it says, because the uterine lining is destroyed, abnormal changes like precancer cells or cancer may develop and grow undetected. This delays necessary medical intervention, allowing potential cancer cells to progress. That's that malignancy again. So first one is it masks the cancer cells. The second one is it can delay diagnosis because the doctors don't have anything to do a biopsy, and you're not getting a red flag of, like I saw, the spotting. So the third reason why we shouldn't have this as postmenopausal women is that you can have inappropriate treatment. So uterine ablation is designed to treat benign causes of heavy menstrual bleeding in premenopausal or perimenopausal women. It is not effective or appropriate treatment for cancerous or precancerous conditions. So this is designed, the ablation is designed for what are they saying? Premenopausal and perimenopausal women only. Yes, only. And it's not, but if those women do have cancers or precancerous condition, it's not a good option for them either. So you could get inappropriate treatment having this. And the final reason why postmenopausal women should not have the uterine ablation is evaluating postmenopausal bleeding. So what this says is any bleeding that occurs after menopause requires a prompt investigation to find the exact cause. Typically done through an in-office endometrial biopsy. I had ultrasound. I had hysteroscopy. I had or hysteroscopy. Ablation should be considered only after a thorough medical evaluation has been completely ruled out of cancer or precancerous conditions. So what this is saying is that once your doctor and you have your biopsy and everything else, and there are no cancer or precancerous conditions, then maybe you guys can, it says, have a thorough conversation about having this procedure. So again, I'm just going to give you the highlights. 4 reasons why menopausal women should not have this. It can mask your cancer cells. It can delay a diagnosis. You can get inappropriate treatment, and then evaluating the postmenopausal bleeding. Probably the same thing. So this made me stop and think this very question, which always leads me down into another level of research or things like this. But this is how my brain works. So my brain is sitting here thinking, what would have happened if I would have elected to have this procedure perimenopause or post or premenopause, or maybe I had some heavy bleeding and this procedure was mentioned to me early on in my life, late 20s, early 30s, and now I'm postmenopausal. So that means there's a potential that a cancer diagnosis would be missed, and they wouldn't be able to test to do a biopsy because my uterine lining has been severed, essentially. So I was thinking, like, is this a good procedure? Because we don't know what's going to happen down the line. I didn't know I was going to be on this journey, during this time of my life. So I'm wondering, is this a good procedure? But then I think about the women that, that have those heavy bleedings and those cramping that have you bent over so much, you got to go to the hospital for them to give you something to help you stand up straight. So that's why I say, we have to go to our medical doctor so that we can make informed decisions about the healing journey that's best for our body. But I think doctors need to say that last point too. Uterine cancer is on the rise, and so you want to make sure that you can be detected and detected early for it too. So it's kind of I think with all the decisions that we have to make, and listening to the great women in that room yesterday, everybody has had to make decisions that they thought was best for them at that time, and that was going to bring the best resource of healing to their body. And that is, and sometimes we have to, like one lady in the room, she had to make that decision early on to have a hysterectomy because of the bleeding. There was nothing, they tried everything. And then her doctor, so I think she waited 5 years. 2 women in the room said they waited 5 years to see, to do other kind of things before they had decided to have the hysterectomy. So it wasn't a decision made and lightheartedly. They all say that they had the same doctor during that time, and the doctor was like, "Okay, are you ready? Are you finally ready? Because nothing else is working." Because they had that hope of motherhood, they had that hope of motherhood still lingering, but they were in so much pain. So that's why I got emotional earlier, because we as women we make some tough decisions that sometimes no one even knows about, because we are, making these decisions on our own. So, and, people may say, oh, that's just a woman issue. It's really not. It's a humanity issue, is how I'm feeling at this moment. After I left the talk yesterday, I was just really thanking God for all of the women that were so open and sharing their experiences and what they've been through. It's a lot. It's a lot. It's a lot. So it also makes me think too, when you don't have children, we have to be careful how we approach people too, because that could be a very sensitive subject to somebody that it's not that they didn't want it, it's just that they didn't have the option to have it medically. So, and then there's other options we know for adopting and things of that nature, but we have to be really a little more sensitive about asking, when are you going to have some kids, or why don't you have kids, and things of that nature. So just want to give you like 4 examples of how this ablation is performed. And I think there's up to 6 or even more. So doctors use various methods. And one of the ones is they use radio frequency, which they use a high energy radio waves that takes about 1 to 2 minutes. The second one is cryo ablation, and they use extreme cold freezing method to destroy the tissues. The third method is a microwave heated fluid that they use to destroy the tissue. The next one is electrocautery. I hope I got that right. And they use an electric current to remove the lining. And this one typically you need general anesthesia for that one. So That's one. And they said the recovery is fairly quick. Most women can return to work and resume normal activities in 1 to 2 days. However, you should expect, watery or bloody vaginal discharge, which could last up to several weeks. So, although you're able to, go back to your normal activities, you should still, I say, take it easy on yourself. And so, the risk. So they say generally this is a safe procedure that can happen, but you could get an infection, you could have bleeding, you could have an accidental puncture of the uterus or nearby organs. I said, what? And I'm sure that's possible in all procedures. But that was like, what? Okay. And then you can have cramping and pelvic pain from that. So, and as usual, I have a couple articles for reference. So, and I try to get something that's current because, like I said, the two books I have here are from 2006 and the new one I just got 2026. So the article I got from the Mayo Clinic is from October 2025, and this will all be in the description. And the title is Endometrial Ablation. The second one is the Cleveland Clinic. It's from January 2025, and it's also entitled Endometrial Ablation. The third one is from Raveco Medical, and it's from August 2025. What patients should know about endometrial ablation success rates. And between those two, one of them the success rates. One of them actually has pictures of what happens during the procedures that I did like. That's why I included it here. And the John Hopkins Medical didn't have a date for that one. That's also called endometrial ablation. I like this article because towards the end of it, it explains what your expectations, like walking you through what your expectations should be if you're going to have this procedure. So I thought that was something good to help manage your expectations. So again, I know that, I've been talking a bit, but I just wanted to really give as much information as I could as possible and understand that my mission is still to provide information regarding uterine health and uterine cancer. And I try to just give you like the bullet points and to, have the articles of reference for you to, go out and do additional research if you feel like something is resonating with you or someone else that you know. And so that's why I said, I do the high level bullet points and that should be it. And just like for me, I took a little moment to do the menopause. Once I saw that statement, I went and, did my deeper research about menopause. So that's an example of doing a little deeper research when something kind of resonates with you as well. And as always, I always say as you're doing your research that, of other options for, the better healing for what might be the best way for healing for your life is to please, please, please go see a medical doctor, work with a medical professional. It's nothing wrong with getting a second opinion. Don't let them feel like, if you present questions to them like, oh, you don't know what you're talking about. Don't let them do that to you because this is your body. You know what you're feeling. Only you know what you're going through. We appreciate their medical advice, but we're here to work together. You're not trying to tell them what to do, but you're saying, is this an option for me? Just don't say hysterectomy. Why isn't this an option for me? And then they may tell you, due to your conditions, why this may not be an option for you, because it does say that, just because something is recommended, it may not work for you in your body, right? So I just, also wanted to say that as I was thinking about this, I was praying that as I prayed that we take away the stigma and the silence of us suffering by ourselves. I really pray that that you have someone in your life that you can. I just pray that you don't have to suffer in silence, and there's somebody in your life that you can talk to, that you can that's that friend that's going to come over and help you if they know that you're on your cycle and you're bleeding, like that. Maybe they can come over and make you some tea or bring you some hot soup or something like that, just so you're not in this by yourself. And I'm praying and hoping that we as women learn to give ourselves grace, but also to give grace to other women. Hopefully we're not shaming other women or anybody in the world, and we are having compassion. So if they are sharing, it's not like, well, why did I? No, it's more like, how can I be of service to you? And sometimes we may not know how we need help, but sometimes we may just say, hey, I'm going to come over. I'm just going to bring you some soup. I'm going to bring you some this. And just so you'll have that, do you need me to pick up any extra pads? Pick them up anyway. Sometimes we say we don't need anything, but having that person there, it does a lot for us mentally. So I pray that no one is suffering alone. So lastly, but more importantly, if you are having any discomfort and heavy bleeding and it's just been a lot for you, reach out to your medical doctor and try to, develop a plan that leads towards healing for you and your body. And if you have the ability and you think somebody might be there for you, reach out to them as well. Don't suffer by yourselves. If sometimes people can't do a lot, but they can do small things. I don't know, take you to the doctor's office because you're in such pain that you can't drive yourself. You don't have to do everything alone. But I do know that sometimes we have nobody and it is just us and we have to figure it out. I do understand that too. So I am there with you and I totally, totally understand. And I have nothing but compassion for you. So have grace for yourself because that's what I had to teach myself as well. So once again, I hope that you have a great day and that you learned something very valuable for this. I'll be sharing some other information that came up during that conversation that really piqued my interest that I've already started kind of researching that I just didn't know about. So I hope that you have a great day and you continue to be well and that you continue to be in perfect peace. Take care. And again, if you have any questions or comments, please put them down and below. They're encouraging for me too, this stuff today, really, I was crying as I was putting this script together because it was just so emotional for me. So I hope that you have a great day. Talk to you soon. Talk to you tomorrow, right? On day 16.